I have some options for you.
Okay.
It's going to be spicy.
I didn't think I was going to cry. It's weird. It's weird.
Feeling good feels weird.
It does.
Welcome to the office. Hi, Trudi.
Hi.
Welcome to the office. How can I help you?
I've been having some pain in my thoracic spine for about 7 years.
What happened?
I was picking up my granddad, taking care of him at home at the end of his life. He kept falling, and I thought I could pull him up a stair at a time by the stairwell to pick him up because it was like 3 in the morning, and I felt like a pop and a sharp stinging pain
In the middle of your back?
in the middle of my back, and it lasted probably for about 12 to 16 weeks before it
Did you see
completely
anybody at
resolved.
that time?
No, I did not.
You just dealt with it?
Yeah,
Okay.
yeah, I did. And I kind of hurt my neck in there a little bit too, but it wasn't anything as major as this was.
Okay.
But I mean, this has been it every day.
This was 8 years?
About seven and a half.
Years.
Yeah.
Okay. And so you just kind of let it go.
I did.
Now, why now? What's going on
It's
now?
just getting so painful, and there's a lot of other things, you know.
But where are you
that
coming
just been
from?
happening. Kansas.
You come from Kansas.
Yes.
What part of Kansas?
Syracuse, Kansas.
Syracuse, Kansas. When did you seek care after the injury?
Probably the first time about 2.5 years
After the injury.
after the injury. And then about 2.5 years ago, I ended up at
Okay.
an orthopedic group there. And basically I got a spinal injection,
Okay.
which did help for about 3 or 4 weeks.
Sure.
But it was so painful. And then
You
everything
got
that
an
I've read.
epidural cortisone shot.
Yes.
Correct?
Yes.
And it's a good Band-Aid.
Yeah, it was. It worked really well for about 3 or 4 weeks.
Okay.
And then my symptoms just gradually came back and just, full force.
But you were told that wasn't really the answer.
Right.
Right?
It was the only thing they
But
were
you,
offering.
but you needed some relief.
Right.
Okay. And that was 2.5 years ago.
Yes.
Then what?
And then I kind of calmed down for a little bit, but came right back with the force. And it just, I don't know, I'm getting ready to be in my busy season because I farm and do stuff like that. So I just, I
Small
stand
farm,
all
couple
day.
acre farm?
Yeah, just a little.
Just a
yeah,
couple
Just
acres.
a little.
All right.
And then I get ready for harvest and stuff too. But
Okay.
I coached track. I was a runner. I ran every day
Okay.
until this happened, basically. Even after I was running, once it healed, and then I broke my leg really badly a couple years ago, and then it just kind of snowballed from there, I
Okay.
think. Maybe, being non-weight bearing and then having to hop around a little bit on the good leg, I don't know. But I made it mad.
Okay. So right now your main issue is the mid-back.
Main back is
What
my
else
biggest
is going
one.
on?
I get a lot of pain, almost like my hip comes out,
Left hip.
left hip.
Okay.
And then I get a lot of sciatica.
Down
and
the right leg.
down the right leg, through my knee, and down into my toes, I think.
And what did we do to the foot?
I broke my leg right above the ankle bone, or I guess
Okay.
it is on the ankle bone. I broke that, and then the 5th metatarsal and the 3rd metatarsal. I broke both of those.
Okay.
And I've never really had anything done with that. We just kind of put that in a walking boot and stayed off of it for an
And just let it
extended.
heal up a
Yeah.
little bit. Okay.
Yeah.
All right. So why here? Why now?
Well, I've exhausted everything else.
Mm.
And I saw what you were doing with people who've had chronic pain that, often doctors just kind of discard us as something they can't fix, so they don't treat us. And I think that's, not how I really want to live my life going forward. I really want to be able to have somebody that can listen to me and offer me, some options and help me take care of myself, because I think that's important.
I have some options for you.
Good.
It's going to be spicy.
I figured.
Okay, I'm just letting you know.
I knew I was a mess coming in
Okay.
here. I
It's
did.
not
I knew.
It's actually not as bad as you think.
Good.
Okay, so I'm not discounting your pain.
Oh no.
We can look at an x-ray, and I say this a lot in the past. We can look at an x-ray that looks normal or
Yeah.
mostly normal, and the person is in chronic pain. You can see an x-ray that has all these curves or scoliosis or
Yeah.
degeneration, and there's no pain.
Mm-hmm.
So it's all relative, you know, and this is about you and your case and what do you want to be doing? You want your quality of life,
I do.
right?
Yes, I do.
So it's not just harvesting, it's everything
Yeah.
else.
It's like bending over and picking up my grandkids.
Okay.
It's like
How many grandkids?
4.
4. What's the
4.
age group?
4 to 7 months.
Okay, right on.
Yeah, 2 daughters with 2 kids.
Very good.
And so they're amazing, but I really struggle picking up like the little boy and anything with those car seats.
Mm-hmm.
I just can't do that.
And what do they say when grandma can't pick her up?
Oh, he wants to wrestle and he wants to play on and wants me to be the horse, of course. And
Of course, a horse is a horse, of course. Of
yes,
course.
and there's days when I can play and there's days I can't.
Well, here's the thing, even after you're here for 4 days.
Yes.
So there's a lot of expectation in 4 days.
Yes,
I'm
I
going to
know.
do the best I can.
I know.
I am going to give you some answers today.
Okay, good.
And we are going to start. Because we have a short duration, I'll probably see you twice a day.
Okay.
Okay, whatever I got, at least tomorrow we'll see you twice. Friday I can see you twice. And so number 1 is the mid-back. We have some sciatica. Foot is okay.
Mm-hmm.
You feel it, but it's not a major issue.
Right. It's
Correct?
more in the morning.
Okay,
when
how
you
about
get up.
digestion, energy?
Well, that's always been poor. I have a lot of food allergies, and
Okay.
I have an inflammation.
Mm-hmm.
I just swell up like a balloon. I just had my 30th class reunion, and I couldn't believe that was me standing there in those pictures. I was just so swollen. And
Well, I may have some answers for that too.
okay,
Okay,
good.
let's go over your x-rays. After your
Okay.
x-rays, I'll do the exam, figure out where we're going to start. This is you. This is looking at you from behind. This is your A to P film.
Okay.
24 bones in the spine that move, 23 discs in between. This is the foundation of your 24-story building. You're complaining around the 10th floor. Okay? On your side profile, this is the side. We're looking at curves. We're looking at posture. We're looking at discs. And I will be going in a lot of detail along the way. First thing we want to do is let's talk about this. Actually, let's talk about this one first. And on this x-ray, what we're looking at is a few things. Let's look at your posture first. And first thing in the posture is we're going to run a plumb line, a posture line. And we run it straight up from the lowest lumbar, which is your L5. This line should go through the base of the neck there and C2 here. So what it shows us, it's not a lot, but it is there, that your upper body is slightly behind the foundation. So I know you're going to get tension and tightness and pain across the shoulder blade area too. And that's related more to the posture. Second thing we're going to look at here is the curve. What does our curvature look like? We are designed to have 60-degree reciprocating curves, 60 in the low back, 60 in the mid. And, you know, we used to say 60 in the neck. Some books are now saying 40 to 60. Okay, so when we're looking at your neck, do we have the right curvature? It's a little off. There's actually a little bit of 2, 3, 4, 5, 6, 7. There's a little bit of stair stepping. There's some ligamentous issues going on here. We've had some damage to the neck, okay? And we're going to see what we can do about helping restore some of this for you, at least get it started. Okay, at least let's get it started. And I'm going to see if when you're going to be able to come back, hopefully after harvest or something like that, okay?
Yeah.
And if you need to fly down for a couple of days, you should be able to, I'm assuming you're okay to do that.
Absolutely.
Yeah? Okay, awesome.
I'm committed.
All right, well, so am I. Let's talk about your disc now. Now I have a lot of good news here.
Good. 5
is good, 4 is good. I do want you to see these slight circular patterns here, okay? That they should be level and parallel. And what that's telling us, there's a little bit of curvature we'll see on the other x-ray. But I'll show you here. Okay, you see this curve, how it curves a little bit? So because of that curve, we're not looking straight through the discs. We're seeing these circle patterns. Okay, it's not that they're bad. They're great discs.
Okay.
Discs are good. 5, 4, 3, 2, 1. Starts to get a little bit different here because of the curve again. And this is where you did something nice, okay? Let's do this. Let's switch this over here. Let's switch that over there so you can see better. Yeah? Now, as we look here, you still have disc there.
Good.
Okay? That's the good news. You hit this. This is almost like a compression injury. Now, 9 and 10 are right there. 9 is kind of sandwiched in there. We're going to have to bring 10 underneath is what we're going to have to do.
Okay.
Now, typically in the lumbar spine, what happens in the lumbar spine when the vertebrae misalign, they go back and down.
Okay.
But in the thoracic spine, they go back and up.
Okay.
Okay? So when we're looking in the thoracic spine, we're seeing what? You see how all these are open more in the back?
Mm-hmm.
These are all compensating to this. It's starting there. But here's the kicker. You see how these have the circle patterns?
Yeah.
This is a compensation. You were predisposed to have that from your low back. Okay? So the fix and the relief is not going to be here. It's going to be first working on your foundation.
Okay.
And then this is probably the one we'll need to work on. But you see, let me rewind. These are circular patterns. They level off here. So I have a feeling this is a long-standing compensation that was damaged. Okay, and that's why it's not getting fixed. So even before we touch it, you'll tell me after whatever I find, the change.
Okay.
Okay, or no change. Fair enough? Now I'm going to look just real quickly on this section. I'm going to run a little line here just to see. Annotation, lines. Let's make a line, okay? All right. So we're going to take this line from here. This is our sacral base. 5 goes off the level on the left. And what I'm looking at is what's the next one that levels off. Look. So from here, that one tilts. You see it, right? On the left. Tilts on the left. Tilts on the left. Still tilts a little bit on the left, yes?
Yeah.
And then it switches again to the right.
Right.
Do you see that?
Mm-hmm.
Okay, switches to the right. Let's do this. Switches to the right, to the right, to the right. Now we're at 12, 11, 10, 9. It's in a compensation. Now I'm going to go back down again. I think I think this is really the one. So let's rewind that. 5 is a potential, 4, 3, 2 levels off. 1 is the fix. But we'll see when we examine you. Because I said earlier that the one that looks the worst is usually not the problem. That's the interesting part. And I'm going to actually take that back. That's not it. She's going to make me work, guys, but it's okay. That's what I do. It's all good.
It's those redheads.
It's those redheads, from Kansas.
Mm-hmm.
I'm just kidding.
I know.
I'm totally kidding.
It's okay.
We got some. Okay, so that's where we're at. But you see what I'm looking for the level disc from the sacral base. I don't see it till I get here.
Clear up in my chest.
You see, all of that is compensating.
Mm-hmm.
So this is never going to feel better unless we work on the foundation. And the interesting part is you don't have a short leg. Your legs are fine. Your hips are fine.
Mm-hmm.
That's the other interesting part. Normally when we see this, we're going to see some sort of imbalance. You don't have a lot of misalignment in your pelvis either. So where is it coming from, guys? Interesting. Mama's gonna make me work here, dude. Hey, Shasha. I'm gonna have to figure this out. There it is. There it is. So let's try it this way. If I look at this, and I tilt it a little bit down, and I bring that down, skadoosh, right there, S1, S2, S3, S3 or S4, no, S4 is level. So it's something down in here, I know it's hard to see. It's either S3 or S4 that's causing that tilt, and then there's the L5. But if we look at the line here of L5, It's a lot, okay? And I'm looking first in the tailbone and the foundation. Yeah, I'm looking there. S1, S2, S3. That's where I'm looking. Okay, I got it. Okay, does that make sense so far what I'm showing you, ma'am?
Yes.
Okay, let's continue on. We're clear on that one. Gallbladder's been removed. Okay, that's fine. We need to talk about digestion a little bit later. Okay, right now let's get you out of some pain. Get you mobile again. When they remove the gallbladder, we know there's a digestion issue. We know there's some hypochlorhydria or low stomach acid. 1, 2, 3, 4, 5, 6, 7. So this is the level. 7's the issue. You like your sugars, don't you? Your carbs? Pasta?
I did.
You don't do it?
I did keto for a long time.
Okay. How was that?
I really got along pretty well.
Okay. All right.
Lately, I've been, I just keep gaining weight. And I'm at that point where I kind of went off the diet, just trying to normalize a little bit.
Okay. All right, so I see 7 as a potential, S3 as a potential. Something's different here. That's the atlas. You said you fell on your head?
I got hurt, yeah.
This is the occiput. I can see a clean line here. That's kind of curved. You see that? This line here, this is a nice straight line of the occiput, of the occipital bone, or the COC1 joint. This is completely different.
Yeah, I was hit hard.
Yeah. The reason I'm saying that is your atlas will probably need to be set from the right. I see it swollen on the right. I have to find it on you. And I don't know how I'm going to set this occiput, but I'm going to need to figure it out if that's where the pressure is. And again, I don't know how you're going to respond to that adjustment. We're going to start on the we're going to check the spine, start on the foundation, go from there. Okay? Now let's go to your foot x-rays. Your foot x-rays.
Oh, they look good. They grew back.
Yes, everything. However, the fibula is rotated out a little bit, okay? The talus joint, we have an anterior talus, and I'll explain it let me explain it on this x-ray. When we're looking at this, 2 things we're looking at. Smooth symmetrical joint space, it's a little closed in the front. This is open in the top, and I was just talking about another case like this earlier, going over a foot x-ray. We have an AS talus, and we have the calcaneus. It doesn't match with the cuboid. So we'll work on your ankle.
Good.
You're starting to get a traction spur at the Achilles, insertion right there. You're starting to get a little bit of a traction spur right here too, barely.
Okay.
All of that from the talus. Make sense?
Good.
Okay, you ready to get started?
I am.
Let's do it. Let's run the meter on the back and let's see what we got. Starting at the base of the neck, head down just a tiny bit, please. And we know there's a lot of instability between C3 and C5, and I'm hoping I don't need to mess with that. And we are getting that atlas on the right. You've had your upper cervical worked on before, ma'am?
A little bit.
And there's that occiput on the left.
Some decompression at times.
Okay. Mm, 5 points, T5, left side. That's liver gallbladder area. And there's a video you can watch. It's a Florida couple that came out. And I talk a lot of detail about the gallbladder and digestion. I'd like you to watch that if you haven't.
Okay.
And we're going to discuss that later in another visit. There's L1, L2. But we already said all of that is compensating. And there it is. So now in order to get this nerve reading on her, it's old, I got to tilt it. S3, S4. Got to tilt it, and because there's a lot of swelling and inflammation there, so it breaks, but it still stays on one of those sides. It doesn't come back to zero with a break. Static palpation. You can see the swelling redness just from the scoping. It starts to pool there, right there. But it doesn't stop. Like it didn't suck in there into that T5-6 area. So we're going to keep following that swelling. Look, all the way down. All the way down. And it didn't stop there either, ma'am. It stops where? There. Okay. Back slowly towards me, please. That's L5. That's S1. That's S2. That's S3, ma'am. Tender. S4. One more. S5. Tender.
A little. Not as much. That hurts.
That's the coccyx. We have coccyx, 5, 4, no, 3 or 4?
4.
4 coccyx. 5, 4, 3, number 2. 2 or 1?
My 2.
But not really, right? Not compared to the bottom.
Not compared to the bottom,
Yeah. I'm going to focus there. Remember I said this is all part of the compensation.
Okay.
We're not messing down there.
My right shoulder always gives me a little trouble, from the base of the neck down into the
I got you.
shoulder blade.
Scoot forward, please, now. Okay. Six, 5, 4, 3, 2. It's hiding right there. That's 1. Yes?
Yeah.
And then that's the occiput up there on the left. Right there. I'm sorry.
You're okay.
Okay. Now look up a little bit. Let me nod your head. Lean back just a bit. Good. Let me nod your head. Right side. Left side. Okay. Head down. Turn left. Doing Devore's test. Turn right. That atlas on the right is what's stuck. Right there. Okay. Stand up for me and let's walk that off a little bit. Okay, walk to the room, into the room and back. So you've still been harvesting all these years, right? You've still been doing your work.
Mostly.
What are you taking? What were you taking?
Over the counter stuff.
What? 2 more times. You said you were a runner.
I was.
Long distance?
Shorter, but more interval.
Okay. Keep going. Don't
Oh,
stop.
I'm sorry.
Yeah, don't stop.
Sidetracked.
Yep. And one more thing before we start, have a seat. Because you came for this T1910, right? I didn't really touch it, did I?
No.
Yeah. She's like, he didn't touch the area that hurt that I'm complaining of. 1, come on the side here. 2, 3, 4, 5, 6, 7, 8. There's your 9. There's your 10. Tender? 11. Tender? Yes?
Yes. Sorry.
Okay. So you feel that, yes? So after I do what I do, we're going to retest it.
Okay.
Okay? Maybe it shows up, maybe it doesn't today. And we're going to do the right atlas, okay? And we're going to set, this is going to be an interesting set because that left occiput may hang us up. And I got to figure out how I'm going to set this. All right. Let's set the right atlas. ASRP. Back a tiny bit there. And I'm going to come down there. Let it relax there. That's the home run. A little different, huh?
Absolutely.
A little different adjustment.
And it didn't hurt.
Stand up, please. Walk it up.
Oh.
Walk a little bit. You okay?
Yeah, I'm good.
I know you
I've waited a long time.
waited a long time. Keep walking.
Okay. Wow.
I'm gonna get the tissue.
Yeah, I'm sorry.
It's okay, you know.
I didn't think I was going to cry, so I'm sorry.
What are you feeling?
I don't know, it feels different. It feels good. Like, now I always have that pain in my shoulder. It's less, like a lot less. It's weird. I love it. I love
It's weird.
it. It's weird.
Feeling good feels weird.
It does. I try not to complain, but I can't help it. I do.
It's okay. Keep going. One
Okay,
more time.
one more time.
And then we're going on for, we gotta do the coccyx and this floor. We're gonna go left side down and I'm gonna set the coccyx. I'm gonna be on the outside. There we go. Look straight ahead now. Straight ahead. Let it roll. Let it roll. Oh, gotcha. Come on up.
Okay.
Swing your legs down. Come on up. Take your time now. Walk it off.
Okay. Oh. Yeah.
That helps set the tone for the spine. Good. Good. One more time.
Okay.
And then we're going to go face down over here, please. Step on the black platform. And we're going to go straight down, okay? That atlas was the big one.
Yeah, it was.
Slide up a little bit.
Okay.
That's good, that's it. I'm down here, okay?
Okay.
Right there. A little bit more. Relax the shoulders. Clunk. Gotcha. Beautiful. And let's get her up now. Step away from the vehicle now. You know I gotta make it a little lighthearted, right? You can handle my corny humor. Walk it off, please. Check it out. That should be completely different now.
It is. I feel like I'm taller. I don't know how to explain that.
I'm excited for you to go to the bathroom tonight.
Me too.
Mm-hmm. One more time, please. When did you find me?
About 2-3 months ago.
Oh, recent. Let's
Yes.
see,
I've been
please.
watching you longer than that. I just didn't.
That's what I'm saying. How long you
Yeah,
been watching?
I didn't consider it an option until I really started watching you. I mean, not just the shorts, but like following you.
Got it. There's people who just watch the shorts. They're just seeing highlights.
Right.
They're not. And one thing I love about is the journey, the story,
Yeah.
and follow the explanation. And not a lot of people want to do that until it's too late.
Right.
Okay, let's see what we got. Starting at the base of the neck. Clear. That cleared your mid back. Madam, that cleared your L1, L2. And you are clear. Check it out.
It's amazing.
Come on back. What you think?
Yeah.
Is it Coccyx? Is it Sacrum? That's 4. That's 3.
Wow.
Different?
Yes.
But here's the real test. 1, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Oh.
Talk to her, dude. What's up?
I don't know.
Let's see. What?
It's good.
So the moral of the story in this case is what? What did we learn today? What did we learn today besides the relief? Jokes aside, what did we learn today?
I should have come a lot sooner.
Well, that too, but no, about the spine, and you were chasing the symptom, the thing that looked like the problem.
Right.
And that was a compensation that was weakened, and whatever you did, yes, you injured it, but it's not the fix.
Right.
And things will shift around, okay? And it's going to hurt some days, it's going to not hurt some days. It's all coming from down here now, okay? And as soon as this atlas is sorted out, I got to get to this occiput probably. Let's see. Not today.
Not today.
Look at that.
I know it. I don't turn my head like that ever.
Look at that. Now you can look over the over your shoulder.
Oh, wow.
Good. Right shoulder, just a little tiny bit. Honk. There you go. Okay.
Wow.
That's where we're going to start.
Okay.
I'm not going to mess around with the other stuff right now.
Okay.
Okay, and the reason why is I want you to go through this experience. I want you to get your movement, your walking.
Okay.
Okay, I will do the ankle.
Okay.
Let's go on your back here.
Wow.
What?
I could lay flat.
Ankle.
Yeah, that hurts.
That hurts.
That
Yeah, that
hurts.
hurts. Calcaneus. There you go. All right, walk it up. It's the Hollywood Magic Board, right, that everyone watches.
Yes.
It just makes sound. It doesn't do anything.
I know. No, it was great.
Walk it out. Check it out.
Oh, wow. Yes. Thank you.
Squeeze. Squeeze. We're good for today.
Okay.
Okay. Welcome to the office.
Thank you.
You're very welcome.
Thank you.